Hi, good morning. My name is Rauschkolb. I'm an anesthesiologist and pain expert, and I work for Janssen R&D. Janssen has conducted this study with Nucynta ER in patients with diabetic polyneuropathy. This is actually the second study of a kind, and we have investigated patients that have diabetes mellitus and that also do have painful condition very often associated with that. These patients selected and that made the entry into the study according to the inclusion criteria here, they were then put into an open label period of 3 weeks where they had an opportunity under the guidance of the study investigator to find the optimal dose of Nucynta ER. They were allowed to titrate up or down so that they could find their dose. At the end of this period, they needed to qualify according to certain criteria. They needed to have at least an improvement in a pain score of 1 on an 11-point Likert scale from 0 to 10. And then they were randomized in 2 equal groups of receiving either placebo or continue on that same dose they had stabilized with Nucynta ER before. These patients were then maintained on a 12-week treatment period, and at the end of that treatment period, the difference between the placebo and the active group was evaluated. This clearly demonstrated, as you see in the results here, maybe you want to focus in on this, that the patients that were randomized to placebo came up with their pain score again, and those patients that were randomized to active drug, they maintained the pain relief. And at the end, we did have a significant difference, statistically significant and also clinically meaningful. These results were absolutely in sync, in line with the results from the previous study. And these 2 studies are now part of a supplemental NDA to Nucynta ER that is with the FDA here in the United States for review for an indication for pain associated with diabetic polyneuropathy.